Hey everybody, this is Dr. Joe Borio with Change Your Health, Change Your Life. Thanks for joining us today. I hope you guys are, especially my upstate New Yorkers here, they're enjoying the weather. I mean, it is probably the nicest day I can ever remember in central New York. It's not humid, sun, there isn't a cloud in the sky. I killed myself out in the yard today. I just had so much fun working on the house with my two sons, and it was a great day. And I actually have to say, I got some work out of both of them. That was shocking. Especially my big guy. But he was out there. He hung right with me for about 4 hours, so it was great. That being said, I wanted to talk to you about diseases and the paradigm, if you will, that's wrong. And we're starting to see some changes finally in the approach of medicine. They haven't figured it out yet, but they're starting to realize that, look, here's the paradigm. You ready? There's no such thing as a disease. Now, we don't look at it that way. We say, hey, look, if I have heart trouble, that's heart disease. You know, that's not exactly true. There is no such thing as a disease. What it really is it's your body adapting, okay, your body adapting to an environment. To an environment that doesn't have a proper nerve supply, it doesn't have good nutrition, it doesn't have good exercise, it's got bad stuff going on up in your head, maybe you're under just an enormous amount of stress, you're not getting proper sleep. I mean, there's something else going on. It's not the disease that's the entity, like this thing. You know, cut it out, radiate it, you know, do surgery, remove stuff, and we're trying to remove diseases when in reality, what it is, it's your body adapting. So let me give you a couple examples. Maybe this will make more sense to you. If I'm somebody that doesn't work out that much, and I say, geez, you know, I'm going to join a gym, and I'm going to get in there 5 days a week, and I start getting in there, and I just start doing curls and exercises with my legs, and bench pressing and push-ups and squat thrusts and all that stuff. And I start doing all this stuff. What I'm going to notice is that my muscles will start to get bigger, what they call hypertrophy. The muscles will start to get larger. I'll start to lean up. So what my body's doing is it's adapting to an environment, to a stress in the environment. I'll give you another example. I'm out there today and I'm doing some shoveling and stuff, and I got some blisters, right? Why? Because for a long time I haven't been doing a lot of shoveling. I like to do yard work. So now the season starts, I start working, and guess what happens? I get a blister. The blister, if I do 2 or 3 of those, when that skin comes back, it's going to grow back 2 or 3 times thicker, and it forms a callus. So now when I keep doing that work, I don't get the blister anymore. So my body is adapting to the stress in which I put it under. So those are areas that we kind of think of as a positive adaptation, right? So I work out, right? I eat better, I lose weight, I get leaner, my muscles get bigger. Okay, so let's look at it the opposite way, okay? Let's say I don't exercise. My nutrition involves eating McDonald's every day, and I smoke cigarettes, okay? My body, everything that it does is it's adapting as it gets, we call it sicker. What it's really doing is it's doing the perfect thing it should to adapt to the stress you put it under. And if you keep doing that stress, what will happen is certain chemicals are released in the body, certain changes in my hormones will start to happen, and my body's doing that to adapt to the toxicity of the environment. But the long-term effect is those changes that my body's adapting to, they start to cause problems in my body. So it's not a disease, it's your body adapting. And that's kind of what life is. Your body is adapting. So sometimes the concept of this can get a little murky, and maybe I'm not explaining it in exactly the way that you would understand it. I apologize if some of those examples aren't working right for you. We can also, the last one I'll use is brushing our teeth. You know, if I brush my teeth and I clean my teeth all the time, they're going to stay healthy for a lifetime. If I don't, what happens is plaque builds up and they start to rot and so forth. So the acid and the things that start to happen to my teeth, much of which is a positive thing that my body's trying to do, the negative effect is that my teeth are going to rot, even though my body's trying to do the right thing with that acid in my teeth. So the reality is that the disease is not the way to attack it. If I know that the typical way my body will adapt to poor nutrition, poor exercise, horrific stress, cigarettes, eating McDonald's every day, and so forth. If I know that the way my body will adapt to that is through increased blood pressure, increased fats, increased cholesterol, increased triglycerides, things that are horrible on my body, and then my body gets sicker. What's the approach? See, when by us attacking the disease, oh my God, you've got heart disease. You need to take 3 drugs. You need to do this. You need to do that. Stop putting salt on your food, whatever. What's happening is heart disease hasn't gone away. Not only has it not gone away, heart disease gets higher every year. We spend 10 times more than any industrialized nation on heart so-called disease. But here's the reality. There's no such thing as heart disease. The reality is your body's adapting to an environment that's very sick for you. The beauty is you're still alive. So guess what your body will do if you change the environment? It'll start to adapt in a better way to the healthy environment, right? Triglycerides will go down, cholesterol will go down, you'll lean up, your muscles will grow, your stress level will change. You know, once you remove these things that are toxic in your environment, your body will lean towards the health. And that's the beauty, knowing there's no such thing as disease. There's only either abnormal function in your body, or many of the so-called diseases, the symptomatology that goes along with certain diseases, is exactly what the body should be doing. It's making a decision to do something short-term to try to address what you're doing short-term, but unfortunately, by making those short-term changes, the long-term effect is you're going to get sicker and sicker and sicker to formulate these physiologic problems that we call a disease. So the answer is, take a look at your environment and make your environment healthier. And here is the beauty, which we forget, that there is a program, if you will, in your body, like a computer program. We'll call it the operating system, that is intended to do one thing: make you work just the way you were intended all the time. You are meant to be healthy all the time. So like the CPU in your car, let's say, for example, you got a car, right? And you got a computer in there. That computer is designed to make sure all the systems in the car work exactly the way they're supposed to. Now there's a responsibility by the car owner. You still got to change the oil. You can't put diesel fuel or water if it's a gasoline car, right? You got to put gasoline in. So you certainly have responsibilities to follow. Make sure the tires are properly inflated, and you drive at a certain a level, speed, and so forth. So as long as you stay within those parameters, that system, everything's going to work as well as it's supposed to. If you do bad things, the system is still trying to make everything work exactly the way it's supposed to, but often it'll fail. If you start taking a Prius and try to do 120 miles an hour every single day, it's not designed for that. If you put diesel fuel in a Prius, it's not designed for it. It's going to get sick. But the reality is there's still a system inherent within the car that's meant to make it work exactly the way it's supposed to work all the time. You have that. It's innate, which means you're born with it. And it's intelligent or organized with intention. So we call it innate, inborn intelligence. So inborn organization. And that the only role of that organization is for you to be as healthy as you possibly can all the time. So knowing that, and knowing your body's alive, and knowing your body's meant to adapt, your body will do beautiful things in adapting to a healthy environment. It'll do beautiful things in adapting to a sick environment, but at some point will reach a limit to where you're going to develop all kinds of problems. So knowing that, you don't need all these pills and all this other stuff. The reality is what you need to do is you need to start making your environment healthier. And as I talk about with every single change your health, change your life, what do we talk about? We'll close here, guys. We talk about what? We talk about eating a good diet. Living food, right? We talk about what's going on up in here. You got to think some positive things. You can't keep saying I'm fat, I'm stupid, I can't do this, I can't do that. Oh my God, what's going to happen tomorrow? What's going to happen tomorrow? That's going to make you sicker. Can't do that, okay? You got to get some proper exercise. You got to get some proper sleep. You got to drink a lot of water. And to understand that, just like that CPU or your computer, your brain is constantly sending messages throughout the body. And if those messages can't get there, the body doesn't work as well as it's supposed to. So the chiropractor works in making sure the CPU, all those messages are getting where they're supposed to. You got to do all those. You can't do 3 of them. You know what I mean? You can't go to the dentist and say, listen, I don't know why my teeth rotted out. I exercise, I work out. Well, Dr. Joe, when's the last time you brushed your teeth? Well, I didn't brush my teeth. Well, that's why they rotted out. So the idea of coming into me and saying, look, I don't take care of my nerve supply, but I eat good and I exercise, you know, you're still getting sicker. You still see these people that do really great things for themselves, right? And then they still die early deaths and they still get sick. One of the main reasons for that is they don't have a proper nerve supply. So you got to get a proper nerve supply. You got to make sure you and your mother and your father and your grandfather and your uncle and your great-grandfather, everybody as co-workers, everybody you know, everyone you surround, best question, who's your chiropractor? Who are you seeing to make sure that you're not ignoring your nerve supply? And there's no other doctor on this planet that understands that innate intelligence. There's no other doctor on this planet that understands that, look, there isn't really anything such as a disease. It's your body adapting to a sick environment. So we add that nerve supply and work on those other aspects to make you as healthy as you can be. That gives you a better life. That gives you a better quality of your life, and it allows your interaction with other people to be the best it can be. In reality, guys, that's what life's all about. This has been Dr. Joe Borio with Change Your Health, Change Your Life. Have a great day. I hope the weather's just even close to what it's been here in Central New York. I'll talk to you guys next week.